Our hospital is located in downtown Los Angeles. We serve a really diverse community, and we're very proud of the heritage that we have here. We've been serving this community for over 130 years. Our residency program is based in family medicine, and so it's a cornerstone of the services that we provide here at the hospital.
The residency program is well established in LA, started in 1984, and we have some very prominent alumni.
Good morning. We're going to have our morning huddle. It's Friday morning.
I am a graduate of this program. I graduated in the first class, and it set the framework for me living and working and practicing family medicine the rest of my career.
I did hear some wheezing. With that, we would prescribe some albuterol.
To serve the underserved was one of the main reasons why I chose to be here. The patients that we serve are truly in need for health care, but at times are not able to access it. Serving the underserved provides such an opportunity to work with multicultural and diverse ethnic people in a beautiful city like Los Angeles.
Because we deal with underserved communities, it's so important for our residents to be exposed to not only the clientele that we serve, but also to see the vast services that are provided at the hospital.
I decided to stay on as faculty because I grew to love the program. I really enjoy academic medicine. One of my many passions in teaching is being able to teach women's health. I'm able to work with residents to do colposcopies, place Nexplanons, IUDs, manage women when they're pregnant, as well as see their baby afterward in the hospital.
We have a community medicine rotation right from the get-go, and it's a great place to interact with our community. We do a lot in homeboy industries. As a medical provider, we are involved in tattoo removal.
We help remove the tattoos that have been there for gang members, and the great thing about it is removing these tattoos helps them provide better aspects in terms of getting a job.
That's a huge integrative part that we all like to be part of.
You do get to see some very unusual pathological and physiological diagnoses that are rare in some places, so it's an outstanding place to train.
Our specialists even tell us that there's a lot of complex pathology that they didn't even see in their training. It's rare cases that a lot of people have not been exposed to, and it's great that we can be on the front lines of that.
One of the coolest things about our program is that we have the sim lab. We get to work with all sorts of different types of mannequins, and these robots are so realistic. They, move like humans. They can track you with their eyes as you walk in the room. You can do point-of-care ultrasound on them. You can do surgical procedures on them to train to make us better physicians.
Are you having any nausea, any vomiting?
The inpatient training here at California Hospital has been vital. We get a unique opportunity to work with family physicians that are working as hospitalists here. They are great resources for us. We get to work with the trauma service, the ICU. We even get to work with pediatric populations in the inpatient settings. So I think that it gives us that opportunity to branch out and see more things that family medicine can do.
The emergency department that we have here, we're a level 2 trauma center, and we get a lot of different cases. We get to help perform procedures, trying to think about the differential diagnosis of why they're coming here, and then understanding what we need to do to admit a patient to the inpatient team.
We do have a specialty clinic, which is going to be our human rights clinic this morning. Who's assigned to human rights? Aha!
We have a human rights clinic. Kendra Gorlitsky is the attending physician, and she has been very involved in working with patients who are survivors of trauma. And by trauma, I mean torture, not only on their medical problems, but she also helps facilitate normalizing their immigration status or helping them with asylum.
I sometimes cry, but tears are healing, and I'm not afraid of them. I honor them.
Residents participate in the Human Rights Clinic. We have human rights once a week.
One of the biggest reasons why I came to this program, being in an unopposed program like this, it gives me the ability to talk to other attendings directly and the specialists so that I can gain the knowledge from them, learn from their experiences directly.
What's your favorite part about the residency?
Co-resident.
Me and my class get along really well. We hang out all the time. Well, we used to hang out a lot more before COVID, but the faculty is very approachable, so we feel like they're our friends and we can go to them for anything.
My number one choice was California Hospital Medical Center. because I really like the residents. I felt that the whole environment, it was very friendly, very inviting, and very supportive. I really liked the camaraderie.
I chose California Hospital for the people. Interns are close with seniors, there's no gaps, and I know this is cliche to say, but it really is a family. I do enjoy coming to work every day, even when my hours are long or you have, a lot of work, like any intern would, but when you have solid co-interns and seniors and preceptors, it makes it worthwhile and you're excited to do it.
Part of the wellness program here, we are involved in organizing activities for the residents. We try to do outings where we go nearby, either the park or a beach. Some of us have actually gone to sporting events before COVID, of course. Sometimes we have potlucks. Dr. Austin, who is our program director, she's part of that as well. We bring about different cultures. Our retreats are fan favorite in the residency because everything is so close by. We can go to the mountains. There was a year that we went to Big Bear. Palm Springs is really close by.
One of my favorite activities about the retreat was getting to know the origin of each other's names. We were able to call each other those names, like the names that our family gave us and all those other nicknames, and that was really cool.
The number one reason that I came here was the type of people that I met when I was here on my interview and the type of family that I've developed here. Everyone is so warm and friendly. Also, the patient population here, that's the type of people that I'd like to serve in my career.
We have our Hope Street Family Margalis Family Center, which provides opportunities for early education.
What grade are you?
Second grade.
Second grade?
It really supports families in our underserved community, and it's a great opportunity for our residents to understand community health really outside of the walls of the hospital.
We do a lot of events there that are integrated into our curriculum. Some of them are creating different programs for the students. They can be either as young as 5 all the way to high school, and we expose them a lot to different healthcare or medical topics that they may or may not be exposed to otherwise. So it's a great way for us to be mentors to these students, but at the same time be able to integrate ourselves into our community.
I'm from Oaxaca, so that's something that I always keep in mind, and a lot of the people that come here to the US, they struggle. And I feel very lucky and fortunate to be here as a doctor, so I can help these people that maybe they were not as lucky to get an education. So that's my plan, to work with this population.
I'm most proud of our graduates having done fellowships in several things such as geriatrics, sports medicine, palliative care. Several of them have chosen careers in academic medicine, and so they are now our current colleagues. And a lot of them have committed to serving the communities, both locally and abroad.
We are absolutely very committed to our family medicine program here at California Hospital. Not only are getting the experience of working at a hospital, but they're getting really the experience of working in the community and serving patients in all walks of life.